Hi, everyone. It's Dr. Lisa L. Campbell, the Growth Motivator. I am back with another weekly book review. Today, I am reviewing Treating Violence by Dr. Rob Gore, MD. Treating Violence, an emergency room doctor takes on a deadly epidemic. When I read Treating Violence, I didn't read it as someone who was just reading another book, right? I read it as someone whose first job in healthcare was in the emergency room. Mercy Hospital here in Chicago, which served the south side of Chicago until 2021 before it closed. The emergency room is not fake. It's not theoretical. It's not political. It's not abstract. It is human. It is immediate. It is the difference between life and death. Dr. Robert Gore, MD, writes from that same frontline reality. It's part memoir, public health advocacy. Dr. Gore reframes violence not as a moral failure or a purely criminal issue, but as a treatable epidemic, one that requires prevention, intervention, and sustained community investment. Drawing from his upbringing in Brooklyn and his decades in emergency medicine, he makes the case that if we truly want safer communities, we must treat violence the same way we treat disease. Identify the risk factors, interrupt transmission, and invest in healing. For someone like me whose journey began in the emergency room and as a consultant, do projects that require me to go into different emergency rooms, this message resonates deeply. The other thing that really hit me as I was reading this book, there is a trauma hospital in Chicago where in the emergency room, there is a medical detector. Enough said. 5 growth moments from treating violence. Number 1, reframing the problem changes the solution. Reframing the problem changes the solution. When violence is only seen as a crime, the solution becomes punishment. When violence is seen as a public health crisis, the solution becomes prevention and restoration. This shift in framing, it's transformational. In leadership and life, how we define a problem really determines how we respond to it. Number 2, exposure shapes empathy. Dr. Gore's early experiences with violence really shaped his passion, his calling. He's not writing from judgment. He's writing from lived experience. Growth requires us to remember where we came from and allowing that memory to deepen compassion rather than hardening us. Number 3, emergency rooms reveal systemic failures. The ER is often the final stop in a long chain of missed interventions: poverty, trauma, educational gaps, community disinvestment. There was this doctor that made a TikTok video, and you know how they'll say a word and they'll go to this side or go to that side. So he was like, all right, is this a ER problem? Go on this side. Is this a urgent care problem? Go to this side. A lot of people go to the ER for simple things, okay? Working in the ER at Mercy Hospital taught me that many emergencies began long before the people showed up at the ER. Dr. Gore powerfully illustrates that what shows up in the trauma bay reflects what is broken in communities. Number 4, intervention must be relational. Through the Kings Against Violence Initiative, KAVIR, Dr. Gore demonstrates that mentorship, community engagement, and credible messengers matter. Real change is relational. Programs that are rooted in trust and not bureaucracy. Number 5, hope is the strategy. This book is not diagnostic, just diagnostic, it's prescriptive. It argues that prevention works, that early intervention matters, that communities can heal. Hope in this context is not this naive optimism. It is a strategic decision to invest upstream rather than endlessly reacting downstream. Healthcare professionals, leaders, policymakers, educators, treating violence is a reminder that what we see clinically often reflects deeper social determinants. For those of us who have stood in emergency rooms, watching the trauma teams move with urgency, this book validates what we've already known, what we all were always known. Violence is predictable, patterned, and preventable when addressed comprehensively. Dr. Gore does not minimize complexity, but he refuses to accept the inevitability. That in itself is growth. Well, guys, listen, thank you so much for joining in to another book review. Don't forget to like, subscribe, and share. Don't forget about 52 authors, 52 weeks. I am hoping to get Dr. Gore on the show this year so we can talk more about his book and his journey. Guys, don't forget to scan the QR code to download a copy of my book list. Dr. Gore's book is on my book list. I'll see you next week. Bye-bye now.